When Provena Health merged with Resurrection Healthcare, it made for big headlines in the Chicagoland area. There is no question that this merger and the creation of Presence Health is a sign of the times when it comes to the ever-evolving landscape of healthcare reform.
As everyone recognizes, it's a part of the national debate that there's a continual demand for change within the healthcare delivery system throughout the country. And that reaches down to every level of operations in a hospital system like ours.
Robert Banwart is the Director of Accounts Payable at Presence Health. The demand for change did, in fact, trickle down to his department. He and the executive leadership at Presence Health decided it was time to automate and finally eliminate costly manual data entry and the stacks of paper that go along with it.
Every year, there is requests to control costs, deliver better service to our physicians and our other direct care staff. Automation of accounts payable, in my case, is a mandate at this point in time in order to achieve those goals, which are derived from very high-level national goals. Once the decision was made to pursue automation and technology in accounts payable, what we decided was that we should try to reach the goal of complete elimination of paper. What I was looking for in particular was a product where we could say, okay, we're actually going to affect the bottom line, where we could actually say we are taking work out of the system, and as a result of this, we are going to have FTEs that can be allocated to be used elsewhere. We were looking for hard bottom line savings.
So Robert initiated an RFP process in search of the company that could offer the very best accounts payable automation technology solution on the market that could provide the cost savings that he was looking for without sacrificing the quality or quantity of work his department is responsible for. After ruling out incomplete and costly alternative solutions such as e-invoicing and outsourcing, he held what he calls a vendor bake-off and invited a number of automation software vendors to Presence Health for live demonstrations.
When we finished the survey of the marketplace, of the products that were available to us, we decided we wanted to set up a process where we could most easily tell which system is going to provide the highest likelihood of actual cost reductions. We provided approximately 100 invoices to each of them, and we asked them to take those invoices, ingest them into their systems, and show us what their systems could do with the data. When we finished the evaluation of the products and the live demonstrations, it was clear to myself and the rest of the team that the Brainware product was the only product that could clearly demonstrate a potential for the elimination of a significant amount of costs throughout the accounts payable process. Brainware was the only product that could take a document, extract the information, and process it to a point that you could say it's ready to be put into your ERP system without manual intervention.
Once Brainware became the obvious choice, the implementation process began almost immediately.
Brainware staff came on site. We met for several days, and then a few weeks later the actual implementation started. From the actual start of the implementation until we were able to come up with the purchase order related transactions in our case, that process took about a month and a half. That's a very fast implementation. What I especially liked about working with Brainware was that they stayed off the critical path. They delivered their products when they said they were going to deliver them, and they delivered them accurately. They were very helpful in walking us through the process of developing the customized features in our case, understanding our business processes and feeding back to us their recommendations.
The results with Brainware have been eye-opening in more ways than one.
As a result of the Brainware implementation, we have been able to reduce our hourly staff, people actually entering data into the system, by about 40%. We've also been able to achieve other benefits which affect the bottom line. We have now the ability to greatly expand the number of vendors that we work with to obtain prompt payment discounts from. That effort would not be possible nearly to the extent that we're now implementing without Brainware. On our purchase order related invoices, what we're finding is about 45% of those transactions are able to go through the verification process without our intervention. And about 75% of the transactions we're able to have the software match automatically the line items on the invoice to the line items on the purchase order. Those percentages are significant reductions in key punching that we have to do within accounts payable. Another area is that we have been able to more quickly identify potential duplicate payments and develop additional reporting mechanisms to drive down the risk of making duplicate payments. When you have a system like this where everything is visible, it's transparent what's happening with the transaction, you're actually driven to continuously improve your process.
The Accounts Payable Department at Presence Health continues to evolve and find new and cost-effective ways to do what it can to streamline operations and at the same time be a more efficiently run operation. Who would have thought that enabling straight-through or touchless processing through automation in this department would have such a profound impact on the doctors, staff, and communities that have come to rely on Presence Health.
Accounts payable is the back office function, and you don't have a lot of opportunities in your career to implement significant change. In the case of the Brainware project, we're implementing some cutting-edge technology in an area that's not used to that. With the procurement of Brainware, I feel we have taken the fundamental step to becoming a world-class accounts payable organization. We're going to be able to stack up our accounts payable operation with any accounts payable operation in any industry after we finish this implementation. And I firmly believe that the benefits of going through this change, implementing this technology, are going to position us for the future in accounts payable to contribute even more directly to the mission of Presence Health.